Hey guys, Dr. Venkat here and I welcome you all for today's journal club discussion, and the topic that I have chosen is most clinically relevant and most frequently asked question amongst the dental faculties with this particular concept. So the question goes here: can we sterilize heat chains and elastics in ortho appliance components? Okay, because these are the components which we as an orthodontist use more frequently by numbers. Yes, compared to archways and brackets, we use most frequently, and they have to be sterilized. And here comes the two questions: that will it affect any physical properties of the material? That means if we sterilize, is it gonna affect any physical properties of the material? If not, which method that we should go for the sterilization? Yes, and to substantiate this question, we have an evidence from Dental Press Journal of Orthodontics published in 2015, and the objective of this particular study was to investigate the effects of different sterilization or disinfection methods on mechanical properties of orthodontic elastomeric chains. So in this particular study, they have taken only elastomeric chains as a sample, not any instruments, and they have divided the sample into 6 different groups. That is, group 1 as a control, group 2, these samples they are going to treat with alcohol as a sterilization, group 3 samples are gonna be sterilized with autoclave, and group 4 samples gonna be sterilized with UV radiation, and group 5 they're gonna sterilize with peracetate compound, and in group 6 they're gonna sterilize with 2% of glutaraldehyde. Okay, and what did they do? All the samples or all the groups they contaminated with a bacteria called Streptococcus mutans for 48 hours, and the reason behind choosing this particular organism is they are most commonly available in dental and oral infections. And what parameter did they choose to assess the effectiveness of the sterilization? They chose the colony forming unit parameters. Okay, and what did they find? They found that in 2 groups, that is in control group and group 4, they found more of colony forming units than the rest of the samples. What can we understand by this? Of course, the control group has not been subjected to any sterilizing protocol, whereas in group which has been treated with the UV, they also showed significant number of colony forming units. So which means to say that UV is not that effective in reducing the bacterial load compared to autoclave, peracetate and glutaraldehyde. Okay, so what did they conclude? Except for ultraviolet radiation, all other methods promoted sterilization without the loss of any elastomeric properties. So this is the take home message. So the take away is all the orthodontic elastics can or should be sterilized for sure. Except UV, all other methods promoted better sterilization without the loss of any mechanical properties. So without any guilt, we can sterilize all the elastics and elastomeric chains with sterilization. Yes, and they also mentioned that the most and simplest method of sterilization is immersing or dipping the compounds in 1% of alcohol for 1 minute is more effective for that matter. And they also given a note that they have taken only Streptococcus mutans as an organism. They also mentioned the studies are warranted with other microorganisms as well for the broad coverage. Okay, and I also mentioned the reference of this article, and whatever the information I conveyed here, the total credits goes to all the authors from this particular article. Yes, so thank you. I hope this simple tip was useful with proper evidence backing it, and don't forget to hit the like button and subscribe my channel, and I am also available in the Instagram as the Braces Doctor, so please check out my page as well and follow my page. Okay, I will see you on the next video. Until then, see you. Bye bye. Jai Hind.